Hello, friends. As a physician who's dedicated decades to caring for older adults, I want to speak with you today not just as a doctor, but as someone who truly cares about your well-being. For most of our lives, we've been taught that more testing equals better health. Annual checkups, screenings, scans, they've become a symbol of responsibility, of staying on top of things. But as we age, our bodies change, and so should the way we approach healthcare. What if I told you that some medical exams, particularly after age 70, might do more harm than good? I know that sounds surprising, but emerging medical research and clinical experience are showing us that certain routine tests, while well-intentioned, can lead to unnecessary treatments, emotional distress, and even physical complications in older adults. These include procedures that carry real risks: sedation, dehydration, infection, or a loss of independence after a fall or surgery that may never have been needed in the first place. Now, let me be clear. This is not about avoiding healthcare. This is about embracing a more thoughtful, personalized approach to it. The goal of today's message is to help you understand 5 common medical tests that seniors may want to rethink, especially when there are safer, simpler, and more appropriate alternatives available. This isn't about fear. It's about empowerment, helping you and your loved ones make informed decisions that respect your age, your priorities, and your quality of life. Because healthcare, at this stage of life, should not be a checklist of outdated procedures. It should be a conversation about what truly supports your health, your energy, and your independence. If this message resonates with you, I encourage you to like this video and share it with someone you care about. There's so much misinformation out there, but together, we can help build a wiser, safer path for aging well. Let's take a deeper look at 5 common medical tests that may pose more risks than benefits for older adults, and what you can do instead. 1. The colonoscopy trap. For decades, colonoscopy has been considered a life-saving screening tool. But after age 70, especially if you have no symptoms or family history of colon cancer, it may no longer be the right choice. Here's why. The bowel prep required can cause dehydration and disturb your electrolyte balance, putting stress on your kidneys. Sedation increases the risk of confusion, dizziness, and dangerous falls, especially in people over 75. What's more, benign polyps that grow slowly over 10-15 years are often treated unnecessarily, even though they may never pose a threat at your age. I'll never forget a patient. George, 82 years old, sharp and active. He agreed to a routine colonoscopy. After the procedure, he became confused from sedation, fell at home, and fractured his hip. The scope found nothing of concern, but it took him months to recover. There's a better way. Non-invasive stool tests, like the FIT test, are safe, effective, and often more appropriate after age 70. They can still detect signs of colon cancer without putting your body through unnecessary risk. 2. The annual full-body scan. Error. It sounds high-tech and reassuring, scanning your whole body to catch disease before it strikes. But for many seniors, CT and MRI full-body scans can do more harm than good. These tests are incredibly sensitive. They often find tiny abnormalities, like nodules or cysts, that are completely harmless but trigger anxiety and invasive follow-ups. What follows? More testing, biopsies, even surgeries that aren't needed, especially in older adults whose bodies are slower to recover. Take Betty, age 78. She was healthy, active, walking daily. But after a scan found a small lesion on her kidney, she had surgery. The lesion turned out to be harmless, but the operation left her fatigued and dependent. She never fully regained her vitality. These tests aren't usually covered by insurance either, meaning you're paying out of pocket for a cycle of fear and overdiagnosis. My advice? Unless you have symptoms or a specific reason, trust how you feel, not just what machines find. 3. Overuse of cardiac stress tests. Stress tests have become routine for older adults, even when there are no symptoms. But after 70, they can be misleading and risky. Why? As we age, our heart patterns naturally change. These age-related changes often show up as false positives on a stress test, suggesting there's a problem when there isn't. And that's where the trouble begins. It often leads to angiograms, stents, bypass surgeries, all of which carry real risks: bleeding, kidney injury, infection. George, 74, came in for a routine checkup. No chest pain, no breathlessness. He felt fine. But a stress test led to a stent, which led to an infection and months of recovery. He told me, "Doc, I wish I had just said no." Here's a better strategy for heart health. Walk daily. Eat a heart-smart diet. Stay socially connected. Manage stress. Unless you're experiencing chest pain, unexplained fatigue, or breathlessness, skip the stress test. Focus on how you feel, not what a treadmill tells you. 4. The hidden dangers of sedation and preparation. This one is often overlooked, but it's critical. Colonoscopy preparation involves strong laxatives that can be extremely harsh on aging kidneys and electrolyte balance. The risk of dizziness and falls, especially at night, is significant. Sedation, too, can linger. In older brains, it can lead to memory fog, confusion, and even long-term cognitive decline. Eileen, a 78-year-old retired teacher, had already had 2 clean colonoscopies. Her doctor recommended another just to be safe. During the procedure, her colon was perforated, a rare but serious complication. She spent a month in the hospital and never returned to her former independence. This doesn't mean ignore your health. It means if you have symptoms like rectal bleeding, unexplained weight loss, or persistent abdominal pain, get checked. But if your past colonoscopies were clear and you have no current concerns, it may be time to stop repeating the test. 5. Excessive reliance on heart stress testing. Heart disease scares us. It feels like a sudden threat, a silent killer. So it's easy to think, better safe than sorry. But in seniors without symptoms, heart stress tests often find normal signs of aging, not disease. And once something suspicious is spotted, it can lead to catheterizations, stents, blood thinners, bleeding complications. Harold, 76, was symptom-free and active. A routine stress test led to a stent, which caused internal bleeding from the blood thinners. He spent months in recovery for a condition that never affected his life. Modern cardiology recognizes this now. Symptom-based care is the gold standard. Unless you're experiencing clear warning signs, routine stress testing isn't helpful and can be harmful. Your heart doesn't need a machine to tell you it's okay. If you're sleeping well, staying active, and feeling steady, that's your best evidence. These aren't just medical facts. They're stories from real people I've cared for. And I want you to take one message to heart. Being proactive about your health doesn't always mean doing more. Sometimes it means choosing wisely. Ask your doctor, will this test change the outcome of my care? Is this based on my symptoms or just habit? Honor your energy, protect your time, and most importantly, advocate for the care that fits your stage of life, not someone else's checklist. If this message helped you, please like this video and share it with a friend or loved one. Let's spread the word so others can benefit from knowledge, not fear. Now, if there's one takeaway I'd like you to remember, it's this. More testing doesn't always mean better care. As we age, our healthcare should evolve with us. That means not just doing what's always been done, but thinking carefully, intentionally, about what truly supports your well-being. There are times when saying no to a test is not neglect. It's wisdom. It's recognizing that a test, not based on symptoms, unlikely to change your treatment, or likely to lead to a cascade of unnecessary interventions, may not serve your best interest. Instead, I encourage you to take a different path, one grounded in discretion, not diagnostics. Talk openly with your doctor. Don't be afraid to ask, will this test change the way you treat me? Is this test meant for someone my age and health status? Put your focus where it belongs, on what matters most. Staying mobile and independent, maintaining a clear, healthy mind, enjoying the people and activities you love. Your health is not defined by a lab result or scan. It's defined by your ability to live your life fully, comfortably, and on your terms. At this stage in life, being informed and intentional is one of the greatest acts of self-respect. You deserve care that aligns with your goals, your values, and your stage of life, not just a checklist made for younger bodies. If this message resonated with you, please take a moment to like this video and share it with someone who might benefit. You never know how one conversation, one piece of understanding can change someone's experience of aging for the better. And if you haven't already, I invite you to subscribe for more thoughtful, evidence-based health insights created just for you. Thank you for taking the time to be here. I'm honored to be part of your journey.